appreciate the opportunity. Thank you, Marilyn, for giving us this opportunity to speak to the Parkinson's group. I'm happy to say that yes, I have been with Gentiva Home Health. It's changed names through the years, but I've stayed with the same company because I believe in home health. I had worked in the hospital setting for probably about 10 years and then started into home health. So the first thing I'd like to ask, is anyone receiving home health services right now in here? We have one, just one person, okay. How about anyone in here has had home health in the past? One other person and two other people, 3, 4, okay. So not too many people have had that opportunity to have home health care. There's actually a couple of types of home health care. There's the Medicare certified agencies in town, and that's what Gentiva Home Health is. We're Medicare certified. And then there's the private duty companies. So first I'd like to speak about the Medicare certified programs and how to get into it. With the Medicare certified home health program, you have to have a physician's order. So you have to be under the care of a doctor, and he has to give us an order that says, yes, this patient needs a visiting nurse, or this patient needs a visiting therapist at home. Right now, it's covered at 100% under Medicare for that service. We can send in a home health aide to also help. Medicare will cover that as long as there's the skilled need for the nurse or the physical therapist to be in your home. So those that have Medicare, how many in here have Medicare, if you don't mind me asking? Okay, well, quite a few. And I know there's a lot of Medicare replacement programs out there, and Gentiva, we are contracted with a lot of those as well. Getting back to the care in the home, so what this involves is first we get the order from the doctor. The nurse then calls and sets up that appointment. So generally we start the day after, say you're in the hospital, you had an accident, maybe a fall, maybe you had surgery, what have you. That nurse will call, set up that appointment, and the first thing usually she does is tell you to get all of your medications out on the table so she can review those with you, because we know that's very important to, they call it medication reconciliation, and it's actually looking at what you've been on at home prior to going to the hospital, and then what the doctors that have seen you at the hospital are also ordering. So a big part of home care is making sure your medications, that you're on the right dose, you're taking the right dosage, and so forth. The nurse can change the bandage, so you go home, let's say you had surgery, she will do, change the bandage for you. Most likely also try to incorporate a family member to help with that or show them how it's done, because sometimes it needs to be changed 2 and 3 times a day. So we're really in the business of education. So we really want to educate the family as well as the patient on how to take care of themselves at home. The people that qualify for Medicare, 65 years old or older, of course nobody's that age in here, right? And or you've been disabled for a couple of years, say you had an accident or something, and you've been disabled for a couple of years, you'll qualify for Medicare. Or you're on dialysis and you've had maybe a kidney transplant, that will all qualify you for that service, those services. Now, if it's, let's say it's a fall situation, and the doctor is just ordering physical therapy, well, that physical therapist will call ahead and set up the appointment in your home, come to your home, and your home can be, like Ann had said, it can be an assisted living. So home health can go into assisted living, they can go into your private home, independent living facilities. We just can't go into skilled facilities, skilled rehab facilities. Which Mary will speak to after I'm completed. So Basically, it's teaching and getting you through that period of time that that is so important, like when you first come home from the hospital. That's a real crucial time. Of course, years ago, they kept patients for weeks on end in the hospital, and they were almost healed when they went home. Now, of course, with all the regulations, you're out the door. Hey, if you stay more than 3 days, that's something, right? They got to get you in, get you out. So that's where we really can come into play. We're kind of like the eyes and ears of the doctors at home. And of course, we report back to the doctor, who in turn gives us additional orders or changes medications, what have you. I would like to also speak a little bit about the private duty companies, and there are a lot of companies around. So these companies, they don't have to have a doctor's order to treat you. You can just call them. The phone book has got lines and lines of private duty companies, as well as Medicare companies too. But they can curtail their services to fit your needs. So these would be the people you would call if, say, you just wanted them to come in for an hour to help you maybe get a bath, or transport you to the doctor, maybe check your refrigerator for groceries and things. Doesn't have to have a doctor's order at all for those services. So that's the private duty, and there's a lot of good agencies in town. You really probably want to try to stick with the ones that are licensed and bonded, so you can ask those questions about that. And a lot of times, if you have long-term care policies, I don't know, does anybody in here have long-term care policies? Great. That's the companies that will cover that private duty. You can look into that. Sometimes they'll cover, depending on what your policy says, up to around-the-clock care. Sometimes, we can have that. So we work in conjunction with the private duty companies to make sure that you're doing okay. So sometimes they'll send in the like the homemaker, or they'll send in the home health aide, and then we'll be sending in the nurse and the physical therapist. So you can have both of those services going at the same time to give you more care at home. Okay, I would just like to probably end with saying that you always have a choice for your home health care. I'd like to think that people would choose Gentiva Home Health. We are like one of the nation's largest home health companies.